Testing is a critical tool to understand the true scope of the spread of the virus.
We cannot stop this pandemic if we don't know who is infected.
Robust testing is particularly essential after early cases are confirmed in order to identify and trace potential points of contact and tamp down on the outbreak. The COVID-19 test uses fairly straightforward testing procedure. It's called PCR, or polymerase chain reaction, and it's actually a pretty basic testing technology. So why the bottleneck in the US? A few reasons. The first, red tape. At the beginning of the US outbreak, the CDC sent out test kits to public labs around the country. These were the only tests that were authorized by the FDA to test for COVID-19. But there were a few problems. The biggest one, the tests were faulty.
The CDC developed a test the same way it does for every pandemic situation, the same way it did for H1N1, the same way it did for the Zika epidemic. Typically, that system works really well. Something went wrong when the CDC delivered those tests for verification at the public health labs. Some of them were returning inconclusive results. And so the CDC had to scramble and send out new kits or figure out a workaround. They did that, but it led to delays.
Another issue? Those tests were only sent to public health labs, leaving many other types of labs, academic labs, clinical labs, commercial labs, without any approved kits and unable to jump in and help meet testing demand. And also, for many weeks, the CDC issued extremely strict parameters determining who was eligible to receive one of the few available working tests. These guidelines dictated that a test could only be administered to patients who had a fever, were symptomatic with either a cough or shortness of breath, and had either recently traveled from China or had close contact with a known COVID-19 patient or someone who is currently being tested. But even though those eligibility requirements had been removed, it's still super unclear, even today, who can get a test and who can't.
To get tested, it really is a local policy decision. Different medical systems have different policies. The CDC policy, the federal policy now, is that if your doctor wants to test you for it, doctor can test you for it.
And even though the US is now continuously trying to add testing capacity, the country's healthcare system is running into another problem. It's running short of basic supplies needed to conduct the COVID-19 tests. Health officials in multiple states are running low on things like swabs, pipettes, and reagents. Those are the chemical materials mixed with the patient's sample during the testing process. And even though test makers like Roche are supplying hundreds of thousands of tests to labs around the country, the demand is just overwhelming.